Warning: these 8 medications could increase your risk of a heart attack. Every 40 seconds in America, someone experiences a heart attack. But what's truly alarming isn't just this statistic. Hidden dangers may be lurking in your medicine cabinet, as certain medications can significantly increase your risk of heart problems. From common asthma inhalers to weight loss pills, some of these drugs might be affecting your heart health without you realizing it. Medical experts have discovered that 8 widely used medications can impact your heart in potentially dangerous ways. These aren't obscure drugs. They're medications that millions of people take daily for common conditions like asthma, arthritis, and migraines. What makes this particularly concerning is that many of these medications are easily accessible, and some don't even require a prescription. Recent medical findings have revealed that the impact of these medications on heart health can be significant. Some can raise your blood pressure within hours, while others might affect your heart's rhythm or damage heart tissue over time. However, this critical information often goes undiscussed in routine medical visits, leaving many people unaware of the risks they're taking with their heart health. Today, we're exposing these 8 medications and their potential risks to your heart. More importantly, we'll provide you with practical alternatives and essential safety information for each one. This knowledge isn't meant to cause panic. It's about making informed decisions about your health. Understanding these risks could help you take better control of your heart health and potentially save your life. Medication number 1, beta agonists, asthma medications. Beta agonists, commonly prescribed for asthma and COPD, chronic obstructive pulmonary disease, are among the most concerning medications when it comes to heart health risks. Popular medications in this category include albuterol and salmeterol, which millions of Americans use through inhalers daily. While these medications are essential for managing breathing difficulties, their impact on heart health requires serious attention. The primary concern with beta agonists lies in their direct effect on heart function. These medications work by relaxing and opening airways, but they simultaneously stimulate beta receptors in the heart. This stimulation can cause your heart rate to spike dramatically, sometimes leading to dangerous arrhythmias, irregular heartbeats that can trigger serious cardiac events. Medical data shows that using beta agonists can increase heart rate by 10 to 20 beats per minute within minutes of use. For people with underlying heart conditions or high blood pressure, this sudden increase can be particularly dangerous. Regular and extended usage may increase your chances of experiencing a heart attack, especially in patients using higher doses or multiple daily treatments. Warning signs to watch for include rapid heartbeat, chest pain, unusual sweating, or feeling jittery after using your inhaler. If you experience these symptoms, it's crucial to consult your healthcare provider. Medication number 2, COX-2 inhibitors. COX-2 inhibitors, primarily used for arthritis treatment, represent a significant concern for heart health. Celecoxib, Celebrex, stands as the main prescription medication in this category, specifically designed to reduce inflammation while supposedly being gentler on the stomach than traditional painkillers. However, the cardiovascular risks of these medications became apparent after extensive medical surveillance. Studies have shown that COX-2 inhibitors can increase blood pressure and create an imbalance in blood clotting factors, potentially leading to dangerous blood clots that may trigger heart attacks or strokes. The risk becomes particularly significant with long-term use or higher doses. Research indicates that patients taking COX-2 inhibitors for more than a year face a 20% higher risk of serious cardiovascular events compared to those using alternative pain medications. This risk increases substantially in people over 60 or those with existing heart conditions. For safer pain management, medical experts recommend several alternatives. These include physical therapy, which can strengthen joints and reduce arthritis pain, topical medications that don't enter the bloodstream, and natural anti-inflammatory supplements like omega-3 fatty acids. Some patients find success with acupuncture or low-impact exercise programs specifically designed for arthritis management. Medication number 3, diet pills and weight loss medications. Diet pills and weight loss supplements pose a particularly dangerous threat to heart health, with some products causing severe cardiovascular complications. Sibutramine, once widely prescribed, was pulled from the market after being linked to heart attacks and strokes. Even more concerning are the ephedra-containing supplements that continue to be sold through various channels despite FDA warnings. These medications typically work by speeding up metabolism and suppressing appetite, but this process puts excessive strain on the cardiovascular system. Weight loss drugs can cause dangerous spikes in blood pressure, with some users experiencing increases of 10 to 20 points systolic within hours of taking the medication. Heart palpitations and irregular rhythms often follow, especially when combined with caffeine or other stimulants. Medical records show that users of these medications face triple the risk of cardiac events compared to non-users. Young, otherwise healthy individuals have experienced heart attacks within months of starting these medications, particularly when exceeding recommended doses in pursuit of faster results. Instead of risking heart health with these medications, medical professionals recommend sustainable weight loss methods. A structured program combining portion control with regular exercise can achieve similar results without cardiovascular risks. Recent studies show that intermittent fasting and time-restricted eating patterns can effectively reduce weight while potentially improving heart health markers. Medication number 4, migraine medications. Migraine medications, particularly those containing ergotamine and certain triptans, can trigger severe cardiovascular complications. These drugs work by constricting blood vessels in the brain to relieve migraine pain, but this same mechanism can dangerously affect the heart's blood supply. When these medications constrict blood vessels, they can reduce blood flow to the heart by up to 30%, a particularly dangerous effect for anyone with underlying heart disease. Triptans, like sumatriptan and rizatriptan, can cause coronary artery spasms within minutes of taking the medication, leading to chest pain and potential heart damage. Studies tracking migraine medication users revealed a concerning pattern. Patients taking these drugs more than twice weekly showed a 40% higher risk of cardiovascular events compared to those using alternative treatments. The risk doubles when these medications are combined with certain antidepressants or anxiety medications. Medical experts now recommend alternative approaches for migraine management. Preventive treatments like Botox injections or nerve blocks can reduce migraine frequency without cardiovascular risks. New CGRP inhibitors specifically target migraine pathways without affecting blood vessels. Simple lifestyle changes, such as identifying and avoiding trigger foods, maintaining consistent sleep patterns, and managing stress through biofeedback, have shown significant success in reducing migraine frequency and severity. Medication number 5, certain antibiotics. Certain antibiotics, particularly fluoroquinolones and macrolides, carry significant cardiac risks that often go unnoticed. These powerful antibiotics can interfere with the heart's electrical system, leading to potentially life-threatening rhythm disturbances. Medications like azithromycin, commonly prescribed for respiratory infections, have been linked to sudden cardiac events, even in patients with no prior heart issues. The danger lies in these antibiotics' ability to prolong the QT interval, the time between heartbeats. Even a short course can extend this interval by up to 20 milliseconds, creating a perfect storm for dangerous arrhythmias. Data shows that patients taking these antibiotics face a 3 times higher risk of sudden cardiac death during the first week of treatment. Most concerning is the cumulative effect when these antibiotics are prescribed repeatedly. Each course can potentially cause microscopic damage to heart tissue, leading to long-term complications. This risk is particularly high in elderly patients or those taking other medications that affect heart rhythm. Safer alternatives include beta-lactam antibiotics, which rarely cause cardiac complications. Healthcare providers now recommend bacterial culture testing before prescribing these high-risk antibiotics to ensure they're absolutely necessary. Natural immune boosters and targeted probiotic therapy can help fight minor infections without risking heart health. Medication number 6, NSAIDs, non-steroidal anti-inflammatory drugs. These medications, including ibuprofen and naproxen, can trigger cardiovascular events by disrupting the body's natural blood clotting mechanisms and blood vessel function. Medical research has uncovered a startling timeline. NSAIDs can increase heart attack risk by 20 to 50% within just 7 days of regular use. The risk applies even to younger adults with no previous heart conditions. Higher doses, particularly those exceeding 1,200 milligrams daily, can double the likelihood of cardiovascular complications. These medications interfere with prostaglandins, compounds that regulate blood vessel dilation and blood pressure. By blocking these essential compounds, NSAIDs can cause blood vessels to constrict, forcing the heart to work harder. This effect becomes more pronounced when taken during exercise or physical exertion. Laboratory studies reveal that NSAIDs can also damage the heart's protective lining, making it more susceptible to inflammation and atherosclerosis. This damage can persist even after stopping the medication, creating lasting vulnerability to heart problems. For pain management, medical experts now recommend starting with non-medicinal approaches. Heat therapy, targeted stretching, and specific exercises can effectively reduce inflammation. When medication is necessary, Acetaminophen, Tylenol, offers pain relief without the same cardiovascular risks. Natural anti-inflammatory foods like ginger, turmeric, and omega-3 rich fish can provide additional support. Medication number 7. Testosterone and anabolic steroids. Testosterone and anabolic steroids pose severe cardiovascular risks through multiple mechanisms that directly impact heart function. These substances dramatically increase the production of red blood cells, causing blood to thicken and creating dangerous conditions for clot formation. Medical data shows a 30% higher risk of heart attacks and strokes within the first 3 months of use. The danger extends beyond blood composition. These hormones cause structural changes to the heart muscle itself, leading to left ventricular hypertrophy, a condition where the heart's main pumping chamber becomes enlarged and stiff. This remodeling can occur within weeks of starting usage, particularly with high doses or combined steroid compounds. Athletes using these substances show concerning cardiac markers, thickened heart walls, reduced pumping efficiency, and abnormal electrical patterns. Even more alarming, these changes can persist months after discontinuing use. Young athletes, despite their age and fitness, have experienced sudden cardiac events during intense training due to steroid-induced heart strain. For those seeking performance enhancement, safer alternatives exist. Natural testosterone optimization through sleep improvement, resistance training, and proper nutrition can boost hormone levels safely. New peptide therapies and selective androgen receptor modulators, SARMs, show promise for muscle growth with fewer cardiovascular risks, though long-term studies continue. Medication number 8. Chemotherapy drugs. Chemotherapy drugs, particularly anthracyclines like doxorubicin and fluorouracil, can inflict severe damage to the heart muscle. Up to 26% of patients receiving these treatments develop heart complications, with some effects emerging years after treatment completion. These medications attack cancer cells, but simultaneously damage the heart's cellular structure. Doxorubicin specifically targets the mitochondria within heart cells, disrupting their ability to produce energy and leading to cell death. This damage accumulates with each treatment, creating a lifetime dose limit that oncologists must carefully monitor. The cardiac effects manifest uniquely. Some patients experience immediate heart rhythm disturbances, while others develop progressive heart weakness over months or years. Treatment-related heart failure can occur in patients as young as 30, with risk increasing by 5% for every 100 milligrams per square meter of cumulative dose. Modern oncology has developed protective strategies against these cardiac effects. Dexrazoxane, a protective medication, can reduce heart damage when administered before chemotherapy. New delivery methods like liposomal formulations help target cancer cells while sparing heart tissue. Ongoing monitoring through advanced cardiac imaging helps detect problems early, allowing for treatment modifications before permanent damage occurs. Recent breakthroughs in targeted therapies and immunotherapy offer promising alternatives with lower cardiac risks, particularly for certain types of cancer. These treatments can sometimes replace or reduce the need for traditional chemotherapy, preserving heart function while effectively fighting cancer. Medical disclaimer. This information is for educational purposes only, not medical advice. Always consult your healthcare provider before starting, stopping, or changing any medication. Medications affect individuals differently and may have serious side effects. Never self-diagnose or self-prescribe based on this content. If you found this information valuable, please hit the like button and share it with friends and family. It could save someone's life. Subscribe for more health insights and medical updates. What medications surprised you the most? Share your thoughts in the comments below. Don't forget to hit the notification bell to stay informed about critical health information that matters to you and your loved ones.